So it's interesting. Galectin-3 is a protein, and the way I normally explain it to people is I first say it's a lectin. And a lot of people have heard about lectins because they know about lectins in plants, and they know that lectins in plants, if you eat them, can cause inflammation. Well, I say, well, that's lectins in plants. It turns out that our bodies have lectins themselves, and one of those turns out to be galectin and galectin-3. And it's a natural compound, it's a natural protein that's manufactured in us, and it's part of the normal function of the immune system. So that's how I normally start the discussion. What's really going on is you have the immune system out of control, and it turns out that galectin-3 is a core part of that immune system. So we need a normal immune system if we want to fight infection, fight viruses, fight bacteria, fight fungus, and we also need a functioning immune system if we want to be able to heal a cut after we get cut. We want our body's immune system to help with the repair process. So the immune system is a normal part of life, and we need it. We can't survive without our immune system. The flip side is, unfortunately, in many people with chronic diseases, that normal immune system has gone haywire. It's over functioning, and so I wouldn't say that galectin-3 is an evil molecule. It's just that sometimes it gets out of control. And the fascinating thing to me is that diseases from A to Z, these chronic diseases from A to Z, you see galectin-3 in high levels being part of the actual disease process. But again, I wouldn't blame the molecule. I would blame our immune system getting, turned on too much. And obviously, the whole immune system isn't this one molecule, but it seems to pop up in all these different chronic conditions. And we also know at a biochemical level, at a subcellular level, that is having all these roles in something basic like the formation of biofilm, this biologic film that bacteria make to surround themselves and protect themselves from the body's immune system. So again, biofilm was around long before people were ever around. But it turns out that sometimes galectin-3, which is an antibacterial, antimicrobial, so it can actually become part of the whole biological film matrix. In the process of trying to defend against these bugs, it sometimes gets incorporated into it. It's fascinating. We're seeing excess galectin-3 in many of the neurodegenerative diseases, things like Alzheimer's and Parkinson's and multiple sclerosis. It seems that galectin-3 and inflammation are one of the core underlying causes. Not, I wouldn't say it's the root cause because something's causing the inflammation, but it's a higher level cause. And what's exciting is we're seeing actually disease reversal if we're blocking galectin-3. I'm actually using in my clinics a drug that specifically is FDA approved for compassionate use in order to reverse Alzheimer's. And it was approved for compassionate use by the FDA because it's been showing good results reversing Alzheimer's without the bad side effects of brain bleeding and brain swelling that some of the other biologics that have been brought to the market recently are showing. So that's number one. And then the other approach to blocking galectin-3 is binders like pectosol, which I don't think they bind and lower galectin-3 as avidly as this true binding FDA approved for compassionate use IV drug, but I think they still help. The reason I'm going to start measuring galectin-3 levels is not just because we're seeing it in these chronic diseases, but there are also studies now showing that it's a marker, a predictor of life expectancy. If your level's too high, that means your inflammation level is too high, and unfortunately, it means your life expectancy is too low. Now, it is a non-specific marker, meaning it doesn't tell you if the inflammation's in the brain or in your knee or in your heart. It was originally, galectin-3 was originally approved by the FDA as a lab test to look for heart failure. We know in many types of heart failure, you'll see galectin-3 levels go up. But to my mind, it's an exciting um, future test that we'll be getting to measure um, to find out if a patient has increased inflammation, and then also use it clinically to see if it's working or not, what we're doing. I'm starting to use Pectosol binders specifically to lower galectin-3 levels and also lower heavy metal levels. So because we know that many of the heavy metals are toxic and can promote aging, and we want to reverse aging. I think the research in galectin-3 has exploded, and I think we're going to continue to see exponential growth in both the research and also in treatments. So I'm hopeful that very soon it won't just be dementia and Alzheimer's we're talking about using galectin-3, that we'll also be able to use it in certain types of cancers, certain type of arthritis like rheumatoid arthritis, thyroid disease, all these other uh, chronic inflammation conditions. I'm optimistic that we'll be able to target the inflammation and decrease it safely with this new class of drugs. It turns out that galectin-3 forms a network in the process of trying to remove biofilm. Again, biofilm is this biological film that bacteria like the Lyme spirochete will spin around itself to protect it from the outside, including the humans and in our immune system. But our immune system responds to it by throwing in galectin-3 and other molecules. But the cool thing is, what the research has shown is that if you're able to break down the galectin-3 with whether you're using Pectosol or whatever method you're doing to get after the galectin-3, often you are going to be breaking down the actual biofilm, and that's exciting. And one way I describe biofilm is it's like an onion. There are layers and layers and layers to it. So if you can actually attack the galectin-3, you make it more likely that this onion can unravel. And it's fascinating because each layer of this onion of biofilm has potentially different toxins and different infections depending on chronologically. It's like tree rings, you're going back in time. So to me and to my practice, it's been a real eye-opener that we can block galectin-3 and help break down this biofilm safely. So normally what I'm doing is I'm using things like glutathione, which is a master detoxifier. Sometimes I'll use zeolite. So I'm using a cocktail of different. Sometimes I'll use IV phosphatidylcholine to push the fatty molecules. I'm recommending colonics. I have a whole protocol, but to my mind, Pectosol or anti-galectin-3 approach is key for breaking down the biofilm safely. The other key thing is if you're going to be busting biofilm, you want to do it safely. I've definitely seen patients get actually worse if you bust too much biofilm all at once. So my advice in general to the public and especially to any physicians or other practitioners there is you want to go low and go slow because unfortunately, once you rev up your immune system and start this process, there you can't put it back in the Pandora's box. So, and the last thing I want to do is see my patients actually get worse. So that's why I recommend when we're talking about busting biofilm, wherever it is, whether it's in the brain or the mouth or the blood or elsewhere, you want to go low and go slow. We know that there are lectins in plants, and that's one of the reasons why you cook your beans and other vegetables to decrease the lectin levels. I don't want people now to be afraid of galectin or lectins inside their own body. Just to be aware that inflammation is one of the root causes of many, many different chronic diseases. And to my mind, it's one disease, it's inflammation, and if we can figure out a way to safely lower it, uh, our patients are going to be much happier. They're going to live longer lives, and that's why I would encourage people to stay tuned to this whole galectin area, and you know consider using things like Pectosol, which we know will lowers galectin levels.